Hello everybody, this is Dr. Richard Shuey from Back to Health Chiropractic here in Sonora, California. And the topic for my video today is, does back pain actually go away by itself in a few weeks? And the reason that I am tackling this subject is because of what I found on the Mayo Clinic website when I was kind of browsing around. And you can pause the video and look at it if you like. But ultimately what they're trying to say is that 90% of all back pain will go away by itself without any help. That's really ultimately what they're saying in this, but you can read it if you like. So let's find out what the research is. By the way, here, look at this. They say what the research says, and they say that the treatment, the chiropractic is effective, safe and effective, but you could also use pain medications. And then it says that back pain will typically improve within a matter of weeks. I don't know what research they're talking about because everything that I know about paints a very different picture, as you're going to find out here. This is the British Medical Journal from 1998, so it's been known for some time, although this is a relatively new study in a sense. I mean, they're not going to... 98 is a pretty recent thing. I mean, it's not the 70s or anything like that. This is a longitudinal study of 463 patients that were seen by a general practitioner for low back pain, and they were followed out for a full year's time. And what they found was this, is that at the 3-month mark, only a minority of these patients had actually recovered from their back pain, and only 25% of them at a year's time had fully recovered. And so their findings are in sharp contrast to the assumption that 90% of low back pain in primary care resolves within 1 month. That's what they ended up having to say out of that. So this refutes it. Here's another one. This is from the Annals of Rheumatological Disease, and in this study they did the same thing. It's another longitudinal study. They're following people out a year's length of time, and they're doing questionnaires and things to find out how they're doing. And at 269 patients in this one, this was from the Dutch did this. And at the 3-month mark, 12 weeks, they found that 35% of these patients were still suffering. Now they only found 10% at the year's time. That's still, that's much better than the other study. But what they did find is that 3 out of 4 patients, that 76% of these people had relapses. And many of these people had more than one relapse as well. And the average time for the first relapse was 7 weeks, and then it took a further duration of 6 weeks to recover from that relapse. And that really surprised them when they had looked at the literature. They had found they had thought that that these episodes weren't going to happen. They thought it was just going to be one episode of back pain, and that's it. And so they ended up saying ultimately that low back pain is not an incidental temporary problem, that it is more of a chronic issue. And they said that at the end of it as well is that it looks pretty as a valid thing to do is to go out and get therapeutic intervention, meaning go out and get some therapy that is going to be able to identify the problem and fix the problem so that you can prevent relapses from happening. Here's another one. Now this one is really 36 longitudinal studies. So 36 studies just like the 2 that we've seen before this. This was in the European Spine Journal 2003, and they took 36 studies, and then they kind of took all that information and kind of put it all together to see how it would turn out. And this is what they found. They found that there was no evidence to support that 90% of patients will become pain-free within a month. They said that 62% of these people will experience back pain after a year, and they will experience multiple relapses within that 12-month period as well. And they didn't follow them out beyond that because that's what the studies were going at a year. 26 to 37% of the workers that had to have absence from work because of back pain will have relapses. So I want you to realize that those aren't the only articles that I have. In fact, I have 14 more studies, and all of them from these very prestigious journals. Spine is the most prestigious of journal. I mean, it is the most prestigious orthopedic journal out there. The British Medical Journal, Annals of Rheumatological Disease, Journal of Manipulative Physiotherapy, all excellent articles that explain that back pain doesn't do what the Mayo Clinic says on that website. So my point to you is, don't trust any doctor who tells you that your back pain is simply going to go away and it's not a problem. Okay? So the facts about back pain are this: they are episodic. They will come. You will have an episode that might get better in the month's time that they're talking about. and then it'll possibly flare up again. It is chronic in nature. There are studies that I've seen where 28 years, they've followed people out 28 years with these people still suffering 28 years later from back pain. Also, if you have missed work due to your back pain, then it is likely that you will continue to have those periods of time in your future as well. And finally, they looked at the idea, or they talked about something called fear and avoidance behavior. This is something that we find in the rehabilitation of people's backs. It's in textbooks, it's in research, in there they study this very thing, this fear avoidance behavior, because it's so detrimental to you. What it is let's say you loved gardening and then you hurt your back, and now you find that every time you go out and do your gardening it hurts your back, so you stop gardening. Okay, if you use that kind of behavior, the next thing you're doing is, every time I clean the sink or clean my pots and pans, it hurts my back, so therefore I'm going to have my spouse do that because it hurts my back when I'm bending over the sink, or vacuuming, or it could be any number of things. It could be the sports that you like. You could be giving those up because your back seems to flare up from doing so. When you do that, you are increasing the probability of you having worse pain in the future, and the possibility of disability. In fact, in this study here, Pain 2005, they talk about passive coping skills. If you're using passive coping, it is a risk factor for a disabling neck or low back pain. What they found is that if you're using moderate levels of this, that you will have a 5 times increased chance of being disabled in your future. You don't want to do that, obviously. So doing nothing is not the answer. What you do want to do is identify what the problems are, get somebody to help you if you can't figure them out yourself. Identify the problems, and you need to do whatever you need to do to improve on those so that the function of your spine is better. If you do that, you will decrease the number, you will prevent future pain. You will decrease the intensity of the pains that you might suffer from, just right down the board. And I don't care how bad your back is. I mean, you may not be able to get rid of your pain completely, but you can change it and make it far more manageable simply by following the right, doing the right things. Okay, so I hope you like what I've talked about here. And I'm going to, my next video is going to be on how to beat back pain. So we're going to discuss that. You can look at my YouTube videos that are coming up and find out more about that. You can go to my Back to Health Sonora YouTube channel, or you can go to my website at backtohealthsonora.com and find out more information. All right, thank you very much.